Are you considering whether or not to work on an inpatient ward or look for a job in the community as your first job post-qualifying? Well, in this video, I'm going to give you what I think differences in working on an inpatient ward versus working in a community mental health team. If this is something that you're interested in, come on into this video. Hi, if you're new here, and if you're not, my name is Sabrina Phillips and I'm a mental health nurse. I currently work as an interim director in the NHS in partnership with other partners. On this channel, I talk about nurse career advice. I also give some simple lock hairstyles and budget travel tips. If this is something that you're interested in, please like, subscribe and share. For this video, I said I'm going to talk about inpatient versus community nursing, and I'm just going to go through 3 areas that I think are a bit different. So the first thing that you must know, if you work as an inpatient nurse, your working patterns would be shifts. So shifts mean that you do early, late or night shifts, and you're rostered on in that way. And a community team, on the other hand, they're usually open Monday to Friday, 9 to 5. So that's the difference in terms of your work or shift patterns. The next area that I think there's some difference is in terms of the number of patients that you would be looking after. So on an inpatient ward, you have anything between 10 to potentially 18 patients. In community teams, community team caseload could be anything up to, and don't quote me on this, but you can have community teams with a caseload of maybe 200 patients, and this will be the patients in the community team will either have a care coordinator or key worker working with them. And if you work in a community team as a care coordinator, and again, it's dependent on which areas that you work in. So for example, in early intervention teams, the care coordinators have a smaller caseload. For generic mental health community teams, the care coordinators may have a bigger caseload. So this can range from anything between 15 patients to anything higher, and it also depends on the interventions that you're offering to your clients on your caseload. So in terms of patients that you're looking after on a ward, you've got about 18, and you'd be down as a primary nurse, and you might, of those 18, be a primary nurse for 2 to 3 patients, working with healthcare assistants. That's in terms of your patient care. Another difference, I think, or in terms of inpatient and a community nurse, is on the inpatient ward, you will be put down to be the nurse in charge of the shift, which means that you have oversight of all the service users on that ward at that time. You will have a group of nurses working with you, of course, but in terms of organising the handover, in terms of ensuring that task for that shift's allocated, in terms of looking at the resources needed, so thinking about, do you have the right enough staff for the shift coming on and the shift after? Do you need to arrange escorts for service users going out? Have you organised the medication round? So as a nurse in charge for that shift, you are constantly, you're managing the shift, but you're also dealing with anything that comes up. In a community team, as a community mental health nurse, you will be allocated to what's called duty on a rota basis. And again, on your duty day, you're expected to deal with any crisis that comes in, for not necessarily your own patients on your caseload, but for the team as well. And that might include covering people's annual leave as well. So people that are on leave, their patients, if they need any help as a duty worker, you will support with that. So those are 3 different areas, but what I must say is that both places give you the opportunity to learn so much. As a community mental health nurse, you find that you're more of an autonomous work. So you're working more autonomously, you're more lone working, but you ensure that your staff know where you are. And similarly on the ward, you're working as part of a team, but when you're primary nurse for your patients, you're working autonomously with your service user. I hope it will help you have a little think about, where you should go next in terms of your next job. But please do let me know if there's any comments below. If you're an inpatient nurse, is there other things that you think I have missed out? And if you're a community nurse, is there other things that you think I've missed out? And let's be bold and brave together. Bye.